The questions I'm about to go over are a great way to get an in-depth idea of whether a care provider is actually supportive of Vbacs or not. And while the words that they say are obviously very important, I really encourage you to pay attention to the care provider's tone of voice, to their body language, just to their kind of like overall vibe as they answer your questions, because sometimes all of those nonverbal cues are actually more telling than what they actually say. So with that said, the first question is, do you feel comfortable with Vbacs? The most honest component of the care provider's answer is likely going to be their initial reaction. If they're immediately like, I'm so supportive of them, I think they're great for women that are good candidates, like you can really feel that enthusiasm, that's a great sign. If they're like ambivalent, they're like, well, in some cases, I'm supportive. I might be willing to attend a Vbac if everything lines up right. If they're like really wary of Vbacs, then maybe you should be wary of them. How many Vbacs have you attended? So you want the care provider you choose to have attended many successful Vbacs. If they've attended the births of a lot of women trying for a Vbac, but most of those births ended in a C-section, that might be a sign that they're not really too supportive of Vbacs. Next question, what is your cesarean birth rate? You want this number to be low. What is the general Vbac philosophy of the hospital I would be delivering in? So if for whatever reason your Vbac supportive care provider can't actually be at your birth, you want to be sure that the hospital you will be delivering at is also supportive of Vbacs. And finally, am I a good candidate for a Vbac? And the reason I placed this question last is because it's important to get a sense of the care provider's overall philosophy on Vbacs before they assess whether or not you would be a good candidate. Because if it seems clear that they don't actually really support Vbacs, that might actually skew their assessment of your candidacy for a Vbac. Some legitimate reasons that a woman would not be a good candidate for a Vbac would be having a twin pregnancy, a breech baby, placenta previa, previous uterine rupture, fetal distress, like a classical C-section scar. We want that low transverse incision. That's ideal. And take comfort in the knowledge that, according to the American Pregnancy Association, 90% of women who have had a cesarean birth are good candidates for a Vbac, 90%. And, oh wait, this is actually the last question. That wasn't the last one. How confident are you that I will have a successful Vbac? So obviously there is no way for the care provider to know for sure if you will have a Vbac or not. You want them to express confidence, in your ability. If they have determined that you are a good candidate, then you want them to be really excited about that. You want them to be excited right along with you about your chances of having a Vbac. So ask these questions and then just sit with it. After you meet with the different candidates, sit with it, review the answers, and see who intuitively feels like the best option for you.